We're going to get started on the skeletal system. The functions of the skeletal system are support. Remember that the bones support the internal framework and it anchors all the soft organs. Protection. The bones protect all the soft organs. For example, the skull protects the brain. The vertebral column and rib cage protect the heart and lungs. Movement. The skeletal muscles attach to the bones and move the skeleton. The bones are levers and they move the body. Storage. We store lipids in the yellow marrow and we store minerals, specifically calcium, in the bones. So we store both fat and calcium. And the last one is red blood cell formation. We make the red blood cells in the red bone marrow. There are 4 basic classifications of bones. Long bones. They're usually longer in length than they are in width. Short bones are generally cube-shaped. They're only in 2 specific places in general: the carpals of the wrist and the tarsals of the feet. Flat bones are thin and flattened and usually curved. The skull, scapula, and sternum are flat bones. Irregular bones are bones that do not appear like the above types. They are special and have strange, undetermined shapes, like the vertebrae in the vertebral column and the twisted hip bones or bones in the pelvis. This is just an image of the overall skeleton and showing you the carpals, metacarpals, and phalanges of the hand, the tarsals, metatarsals, and phalanges of the feet. This is an example of a long bone, specifically the femur. Remember that the femur has 2 epiphyses at either end. That's made up of spongy bone. And the diaphysis, or the shaft of the bone, and that's made of compact bone, and that has the actual marrow cavity where the red bone marrow and the blood cells are made, and the yellow marrow where the lipids are stored. Let's cover the common fractures. The first fracture is called a simple fracture. This is where the bone breaks cleanly, but it does not penetrate the skin. The second is the compound fracture. The bone is broken and the bone protrudes through the soft tissues and the skin. This is the most dangerous because of infection. Next is the comminuted break or fracture. This is where the bone breaks into many fragments. Then there's the compression fracture where the bone is crushed. Next is a depressed fracture, and that's where the bone is pressed inwards. There's an impacted fracture where the bone ends are forced into each other. The spiral fracture is a ragged break which occurs when there's excessive twisting forces applied to the bone. And the green stick, which is right up there with the compound fracture, where the bone breaks incompletely and is still attached, much like a green twig. This usually happens with young children. Remember that bone cells are called osteocytes, and that stands for a mature bone cell. And bone remodeling is the process where bones continue to grow and strengthen even after an injury such as a fracture. Also, every 10 years, the skeleton is remodeled due to bone remodeling with the osteoblasts and osteoclasts. This slide gives you an illustration of the types of fractures. Now, let's go over the skeleton itself. The human skeleton has 206 bones. The skull is composed in 2 sections, the cranium and the facial bones. The cranium is made of 8 bones. There are 4 major bones, and they include the frontal bone, that makes the forehead and the eyebrow ridge, the parietal bone, that covers most of the brain, the temporal bone, which lies in the region of the ears, and the occipital bone, which is the most posterior part of the head. The facial bones are made of 14 bones, and they're composed in the front of the face. They include the zygomatic arch, which is the cheekbones. Make sure you know that. The mandible, which is the lower jaw bone, and the largest, strongest bone of the face. Again, here's an illustration of the skull and showing you the location of the bones we just covered. Now let's go to the vertebral column. The vertebral column extends from the skull, which it supports, to the pelvis, where it transmits the weight of the total body to the lower limbs. It's made of 33 bones in total. There are discs in between each bone. They're called intervertebral discs, and they're pads of cartilage that can absorb shocks. The 5 parts of the spine include the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, and then the sacrum and the coccyx. The cervical vertebrae is made up of 7 bones. It means neck. It forms the neck region. The first bone is called the atlas, and that is the top bone of the spine. The second bone is the axis, and the axis, or C2, allows neck rotation. C7 is where you can feel the lump in your neck. The thoracic vertebrae have 12 bones. It means middle back, and it forms the major part of your spine, and this is where most diseases occur, in the T-spine, for example, scoliosis. Then the lumbar vertebrae are made of 5 bones. Lumbar means lower back. This is where most of the pain and pressure and weight of the spine is absorbed, and it's also where back pain occurs. This is a picture illustrating the vertebral column from many angles, the frontal, side, and posterior angle. Number 4 is the sacrum. Sacrum has 5 fused bones. It means sacred. It forms the posterior wall of the pelvis, and it attaches to the coccyx, and that is the fusion of 4 bones, or 3 to 5 bones in general, and is the bottom part of the spine known as the tailbone. Now, let's move on to the rib cage. We have the sternum, and the sternum has 3 parts: the manubrium, which is the top part, the body of the sternum, which is the middle, and the xiphoid process, which is the bottom. Now let's go to the rib cage. The ribs are made of 12 pairs of ribs, and they form the chest cavity. The 5 bottom ribs are called false ribs. The last 2 of the false ribs are floating ribs. They're not attached with any cartilage and are thus given the name floating ribs. So in total, you have 5 false ribs, with the last 2 false ribs being floating ribs. This completes the axial skeleton. Now we're going to begin the appendicular skeleton. Let's begin with the pectoral girdle, or the bones of the shoulder. Clavicle means collarbone and attaches the shoulder to the sternum. The scapular means shoulder blade. It's the triangular bone in the back of the shoulder that wings out when you push or lift objects. And then the humerus is the single upper arm bone that attaches to the bicep muscles. Next is the lower arm, or the forearm. We have 2 bones in the forearm, the radius and the ulna. The radius is the lateral bone that attaches to the thumb, and the ulna is the medial bone that attaches to the little finger, or metacarpal number 5. The bones of the hand and wrist include the carpals, which are the wrist bones. There's 8 bones. The metacarpals, which are the 5 bones of the palm, and the phalanges, which means little digits, and it's the 14 bones of the fingers and toes. Next are the bones of the pelvis. It includes the ilium, which is the hip bone, the ischium, which is the bottom of the hip, or what we sit on, and the pubis, the most anterior bone of the pelvis. Then we have the bones of the lower limbs. The femur, the thigh bone, is the largest, strongest bone of the body. The tibia is known as the shin bone and absorbs most of the body's weight. And the fibula, the lateral bone of the lower leg. It is thin and stick-like. Now we go to the bones of the foot. The tarsals mean ankle bones, and that's 7 bones. The calcaneus is the heel bone. The metatarsals are the 5 bones that make up the arch of the foot, and the phalanges, again, mean 14 small digits of the fingers or the toes. Let's go over the inflammatory disorders of the joints. Arthritis is the first one. It describes over 100 different inflammatory or degenerative diseases that damage the joints. About 1 in 7 Americans have it. Symptoms result in pain, stiffness, and swelling of the joints. More women than men are affected. Then there's osteoarthritis. It's the most common form, and it affects the elderly. It results from aging, wearing down of the cartilage that dies and softens out. When the cartilage dissolves, the bone begins to rub on each other, causing painful, sharp aches. Next is rheumatoid arthritis. It's a chronic inflammatory disease that occurs between ages 30 and 40, and it attacks the immune system. Another disease is gout. This is when the uric acid forms in the blood and crystallizes in the joints, causing sharp pain in a single joint that leads to paralysis, usually in the big toe or the great toe. This happens mostly in males, and it's usually before age 30. Finally, the last one we're going to cover is osteoporosis. It's a loss of bone mass leading to thin, fragile bones, especially in the femur. It affects mostly elderly women. However, it can affect men also.